that are really tasty, and I just one of my favorites given the season, pumpkin pie. So if you just want to line up for that, it'll be in the waiting room. You'll have Prince music and grapes and pie just to tide you over. So anyway, so just so you know, I didn't really plan to have any interim hearings at all. And so many things have come up that we're doing this. And, you know, as we accumulated items, there's like 9 items here. I think a lot of them will be short. So I'm still hoping to get you out of here by time for your people is 2 o'clock, little nap or something. I do believe we're going to have a meeting. Again, I had a really troubling dialogue with providers from ARM that run the group homes and such. They are down 23,000 workers, and I do not know what they are going to do. Workforce is an issue everywhere, but as in the nursing homes that we'll mention at least briefly today, and in these places where it's direct care to people who are vulnerable, what is going to happen? And
Mr. Chair, by the way, we are now at 5 with Senator Hoffman joining.
Well, there you go. So he missed my offer of lunch. There's grapes and pie in the waiting room, John. Anyway, pumpkin pie at that. But so it's a big deal, and so in talking with these providers, I said, so let's say you can't staff a house. What are you going to do? And they said, basically, we'll have to call the guardian and say, come get your person. And I'm just really troubled by that. So anyway, that might be coming up, and then whatever dribs are going to be following up this. So anyway, with that, we do have quite a bunch of stuff to talk about. And the first topic is about the COVID language change requests by the governor and the department. The governor put a letter out to actually leaders, not including me, asking for a bunch of things, including some of this COVID language changes, which we have been pretty cooperative all the way through with that. And so I was talking to Senator Miller, our leader, and I said we agreed that it would be good to bring that forward now, at least the parts in our turf. Curiously, there's a list. I don't see the language, or maybe who's ever describing this can tell me where the language is. But anyway, so let's see who's presenting about this. Anyway, Mr. Burdick, why don't you just take it from the top, and then so there's like 6 or 7 of them, and so my interest in this is if they're fine, both to the people on the call and those who are, listening in. You don't have to do anything. If you have an objection or a concern about it, or maybe how they're written, or something that could be improved upon, I would like these to be kind of a consensus. When we did these changes before, between Representatives Liebling and Schultz and Senator Benson and I, and whoever else is interested, if we agreed, off they go. If there's a problem, we either work it out or it falls off. So with that, Mr. Burdick, I'll let you coordinate your crew. Welcome to the committee.
Thank you, Mr. Chair and members. For the record, Matt Burdick, Director of State Government Relations at the Department of Human Services. Thank you for the opportunity to testify today and share more detail about the emerging needs we're seeing at DHS to respond to the ongoing COVID pandemic. As the committee will recall, during the peacetime emergency, Executive Order 20-12 granted the Commissioner of Human Services authority to modify rules and regulations for the programs that we administer in order to respond to the pandemic and ensure people could continue to access services safely. And throughout that process, we were grateful to be able to consult with our HHS chairs prior to implementing each of these waivers, and we've really appreciated that collaboration. And we also appreciate that the omnibus bill that you all passed in earlier this summer continued a number of these waivers, either on a temporary basis or ongoing. However, since the omnibus bill passed and the subsequent surge due to the Delta variant, we have discovered a handful of issues that we believe would be valuable in reviving some of the waivers in order to more effectively respond. And those are outlined in the handout you received. We're also finalizing bill language, which will look very similar to some of the language that you saw in the omnibus bill, referencing back to our COVID waivers and reviving them, and we'll have that to share with you soon. I've got several colleagues here today who will go into detail about each of the waivers we'd suggest the legislature renew for a period of time. And I'll turn it over to Lori Prusine, who will talk about the first item.
Welcome to the committee.
Senator Abler, this is Jennifer Sommerfeld. I think Lori might be having some technical difficulties, so if you could hold on.
Right. Well, we can skip that one. Let's do the next one, Matt, so she can come.
We can move on to Deborah Schlick.
And Ms. Schlick, welcome. Nice to see you again.
Thank you, Senator Abler and committee members. I'm Deborah Schlick. I'm work in the Economic Assistance and Employment Supports Division of DHS. So there are two waivers we had in place through August that we would like to see extended into June of 2022. And they're both about allowing verbal consent when it's not possible to get a signature. One is allowing that verbal consent when someone has submitted an application but is not able to come into the office and does not have internet access, so they can't do an electronic application. And in those situations, and that's been necessary in the past when county or tribal human service agencies closed down their offices because of COVID. And our other interest in this is that SNAP continues to have a waiver allowing verbal consent in place of a signature. And many folks applying for state cash assistance are also receiving SNAP. For instance, 75% of general assistance recipients. So this would be something we would, an authority we would use if, again, we saw local human service agencies having to close for quarantine reasons. And with it are the instructions to the eligibility workers that they have to case note the verbal consent they got from the individual, and they have to enter on the application the date and time that consent was given, and that they have to remind the people we serve that saying something they know to be false is fraud, just as writing down something they know to be false is fraud. And similarly, a waiver that allows someone we're serving to give us verbal permission to contact a third party to verify information, most frequently an employer. But it can be other third parties. And again, if the individual doesn't have access to the internet, if offices aren't open, then over the phone, they can say, yes, you may call my employer and verify my earnings, for instance. So those are the two we would seek to extend. They allow an important flexibility to make sure that benefit determination continues when things get restricted.
Well, thank you. Questions from members? And if I don't see your hand, just sing out. I'm sitting at home just with the dog who's not that helpful in noticing hands. But so any questions from anybody? I have a question. And so I remember talking about this and the counties seem to appreciate it. And so this would be granted on a county by county basis. Is that how that would work? Or is it just something the counties could do and then it would be one of their things they could do if they needed to do it, still preferring people come in person? Is that
it's an authority we want to invoke in a way that makes sense with the circumstances. So it might be communicated by us to say, if you are closing offices and sending all workers remote, accept verbal signatures. Or it might be that we would say, okay, we've noticed County A is closed. We're going to direct them to accept verbal signatures. Yeah, it would just depend if this is happening in a couple places around the state or many places.
Yeah. And so eventually they're going to meet these people live, right? Is it possible a person would never be seen as a human being and somebody from like Iowa or something could get a Minnesota address and apply and get Minnesota money?
They might be seen the way you and I are seeing each other virtually. The protections we have about people being not at all really in state is all their official notices are sent to the address they've given us.
Sure.
So if they've given us a Minnesota address and they don't respond to notices, then, and particularly closing notices, then the case is closed.
Yeah.
And likewise, benefits come on an EBT card. So folks watch if all withdrawals are happening. If no withdrawals or expenditures are happening in Minnesota, that prompts an investigation.
All right. Well, yeah, thanks. And it's just all part of the peril of remote. There's dishonest people around. So I just wanted to mention that. I do think I'm not sure that your system is fail-safe, but it made sense before. And, especially some bigger counties just don't have the energy to follow up for the staff. So anyway, any other questions from members? These seem fine to me, but again, if counties or somebody has an objection, I'd like to hear about it. So, all right, okay. Thanks. So Mr. Burdick, who's next on your list? Yeah, thanks a lot. Nice to see you again. That pie is in the waiting room, but it's really good pie. So, thanks. Mr. Burdick, or who's ever next? Oh, hi. I think you're on mute. At least we can see you now.
Mr. Chair, she's not showing as muted, so I don't know what the audio issue is.
Great. Maybe
Mr. Chair.
You got that cheap state internet package there. Okay, go ahead, Mr. Burdick.
Mr. Chair, well, Ms. Christine is working on her audio. I'll turn it over to Larry Hosh to talk about the next item on our list.
Perfect, thanks. Mr. Hosh, well, how good to see you again. I'm glad you haven't gone away. So.
Good afternoon, Mr. Chair, members of the committee. My name is Larry Hosh. I'm the manager of the Policy, Legislation, and Stakeholder Engagement Unit at the Office of Inspector General Licensing Division. I'm here to talk about CB25 and some of the lessons that we learned during the peacetime emergency and what we recommend for continuing when offering variances and flexibilities for childcare centers. We're recommending that staff distribution requirements be temporarily suspended for licensed childcare centers. Current rule right now says that each classroom must have a teacher qualified staff person. And instead, we're recommending that we just allow one teacher qualified person on site at all times while children are in care. A couple of our recommendations do differ from what we saw in CB25. The first is that we're looking at ensuring that aides must be at least 18 years old if they're working alone with children. Under CB25, there are some scenarios in which somebody as young as 16 could be alone with children. So our recommendations would that they at least be supervised by somebody 18 or older. Additionally, the other flexibility that we recommend is that assistant teachers be allowed to be at the site during opening and closing. Previously under CB25, it required that a teacher be on site at all times, even during opening and closing hours. And this would also provide additional flexibility for childcare centers. And with that, myself and also Peggy Cunningham, who's our manager of our childcare centers, are here happy to answer any questions.
Yeah, thank you, Mr. Hosh. Like I said, it's just a pleasure to see you there. This is again through June. Is that the request?
The request would be through June. Staffing does change, and the ability for centers to hire staff does get more flexible when the school is out, and also be able to reassess our current condition in June as well. So this would be a temporary suspension that we're recommending.
And some of these suggestions, like this very one with relaxing some of the staff standards that in fact may have been almost excessive before. If this works and it's working well, given every discussion about there's just no people to work in these places, I think we should really look at making some of these changes permanent, which is a different discussion, but I know there's a lot of childcare advocates and providers that are paying attention to these hearings, especially given the topic that's coming up. So if you all think it's safe, I think that's a good idea.
We do. And also, Mr. Chair, I would like to thank you and also the House. Last special session, you passed regulation modernization. So we're going to be undertaking 2 projects looking at reforming our regulation standards for both family childcare and childcare centers. And that work will be happening over the next 2 years. And we're happy to have broader discussions as well on how we can modernize our regulations and be more flexible for providers.
Yeah, and I appreciate that. And hopefully that flexibility can extend across the board. And we talked about getting one more child up to 15 in a 2-person licensed home. And this falls into that same category. So any questions from members? Just sing out if I don't see your hand. Okay, thanks, Mr. Hosh. Have a good day. And I'm happy you landed OIG. That's pretty, thank you.
Thank you. It's a pleasure.
Mr. Ms. Poseen, are you, is it working yet?
Okay, different headphones. Is this working?
That's great.
Oh, yay. Okay.
Nice you can be. I'm sorry it's so hard. But,
no, 3rd time's the charm. Here we go.
Well, looking back, there's going to be all these little bingo forms, about, COVID things. And certainly this experience of yours 3 times is going to be one. So thanks for being so persistent.
No, thank you. Yes, I'm Lori Poseen. I'm the manager of the Child Care Assistance Program. And one of the modifications we would like to reinstate from the COVID waivers is to pay providers who have to close temporarily due to health guidance if they have a large number of kids, families, or staff impacted by COVID, and they've determined they have to close a classroom or their program. Normally, CCAP only pays holiday days when a provider is closed, and we would like to be able to pay up to 8 weeks if an entire classroom or program, including home, family, child care center, has to essentially shut their doors. Usually that happens for 2 to 3 weeks at a time, and we've consulted with various people, and we think that 8 weeks, allowing up to 8 weeks between now and the end of June makes sense, supports public health, supports families, supports providers. And those would be days that CCAP would normally, even though we don't pay when they're closed, normally providers aren't closing, frequently, or due to health, entire programs don't close due to health reasons. And so this proposal doesn't cost money because it's money that the program was already planning to pay.
Right. And so this would be 8 weeks cumulative. So it could be 2 weeks here and 2 weeks there. And then at the end of June, you only get 8 weeks. And so,
Correct.
I'm just some things I'm ignorant of. I know that centers were being paid this throughout COVID. If a child care, like a licensed home, had to close, were they paid as well during these COVID
Correct.
Waivers? So
Yes.
they had to close for 2 weeks due to a case, they were getting paid. All right. Just for the CCAP people, of course. Okay. Any questions from members? Seems like a good idea. Any concerns or thoughts from anybody? Well, Mr. Burdick, I think it's going pretty well here. Everybody seems happy with your ideas. And so if you have afterthoughts about being concerned, you're so free to let us know. Thank you, Ms. Poseen, for that. And Ms. Graham, are you next?
I am, Mr. Chair. For the record, Christy Graham with the Department of Human Services. I work in the Community Supports Administration.
Welcome back.
A couple waivers. Thank you, Mr. Chair. A couple waivers that we are hoping to get extended. I'll start with the first one, CV53. This is COVID flexibility related to the Personal Care Assistance Program. So specifically, this waiver would offer the option for qualified professionals to provide oversight via phone or internet instead of in person. So a little bit of background, our qualified professionals are the folks who oversee individual PCA workers. So They play a really important role in providing training, supervision. They develop care plans. They make sure people's needs are being met and that people are satisfied and happy with their services. So under current law, qualified professionals have some ability to provide oversight remotely, but there are some instances where they do have to provide that observation and oversight in person. So this waiver would allow our qualified professionals to have that option of remote supervision if a person does not want someone coming into their home because they're concerned about underlying health conditions that might put them at higher risk for COVID-related mortality or adverse outcomes. So we want to be able to honor that choice that that person is making and just continue to ensure that added layer of safety and professional oversight within the PCA service.
Yeah, and I know this has been an issue, so I think this is probably a good idea. Any questions from members or thoughts? Right now, they can do it every other time, I think. Is that right? For the qualified professionals review.
Mr. Chair, I believe that's close to right. It's every other time, but I think for the first 180 days that a person is getting services from a PCA agency, those supervision visits need to be in person. Oh,
okay. And so you're comfortable that, I mean, this is a COVID thing, and so is this going to, we don't have the language, I don't think, in front of us, but is this going to be that they absolutely don't have to, or if it's difficult and a problem that it could be waived? But I would hate to think that for the first 6 months nobody ever saw the client. So, and I'm sure you've thought of that. So is there a fail-safe there somehow?
Mr. Chair, yes, that's a good question. So this is really all about what the person prefers and making sure that the choice that the person is that the person has the option to make that choice. The default is certainly in person. We do prefer in person whenever possible, and I know that some of our PCA agencies have been really great about working with qualified professionals and families and people to make sure that we can do maybe visits outside once in a while to make sure they're in person. So there's different options, and I know the agencies are doing a pretty good job of working with people as is, but this remote option would be helpful, especially going into the winter months.
Right, and I know the Delta variant's kind of confounded this. I think that on this one, I'm interested to see the language. I'm just concerned about, I'm sure you are as well, but 6 months is a long time. So just we can put a flag on that one for as it goes forward. Anybody else want to ask about that? Okay. So thank you. What's the
Senator Abler?
Senator Hoffman, yeah.
I had my hand up. Were you ignoring me on purpose?
Yeah, actually, you're on the bottom half of my list of participants.
I knew that. So Senator Housley was sending you notes. You bringing up a good point, and thanks, Christy. This is such a weird space to be in because we're supposed to be making sure that the clients who are receiving the services are, doing what they need to be doing, right? To be safe, to be stable, to be all those things, right? And I'd be really interested seeing how, Christy, you're going to try to balance that, because just saying, and I think you guys are heading down that road of saying, no, it's not an all or none, but rather it's where's the safety net? Where's those extra set of eyes that says, Jimmy's mom is actually okay. She's doing fine, right? I mean, and you said it, we prefer face-to-face. And there's a bit of me that's got a concerning if we start to go really all towards that tele-looking kind of thing, that we will lose that aspect. And I think that's concerning, and I think you agree with that. So I'll be interesting to see that language. Do you expect to get that soon, Senator Abler, or is that something that we're working on next session?
I'll take that as a question of Ms. Grom, Senator Hoffman.
Yeah.
Mr. Chair, Senator Hoffman, I think we can get the language in relatively short order here for you. I think the language might be pretty straightforward. So we might need to, in addition to just seeing the legislative language, you might be interested in having a conversation about this a little bit more deeply to understand kind of how we are going to ensure those protections remain in place for people.
Thank you.
And that's something we're absolutely open to.
I appreciate that, Ms. Grom. Thank you, Mr. Chair.
Thanks. And Senator Nelson, actually, Senator Hoffman, I did see Senator Nelson's hand. Somehow she's got a direct link to me. And It's like John Who. Anyway, Senator Nelson.
Thank you, Senator Abler. Well, I just want to mention, it may be tangentially related, but I think it's important that we keep it in our conversation as we're talking about this. It kind of gets to that point of telehealth and face-to-face and that important intersection of the two. And I just wanted to mention at some point, I know next year, there's digital therapy apps that are coming on the market now. And we've had these same type of discussions about the digital therapy apps, but also making sure that there's that face-to-face with the provider. Oftentimes these are in mental health or substance abuse disorders. And as we go forward in answering the questions that you raised, Senator Hoffman, and that Christy explained, at some point, I hope we have some sort of a consistency in how we look at this intersection of telehealth, meeting the needs of the patients where they are, when they need them, and also the importance of the face-to-face. But I just wanted to mention it's not just in this arena, but I think this is an example that we'll be discussing as we move forward in other innovations as well.
Yeah, super, thanks. Anybody else? And like I said, if I miss you, don't be afraid to speak up. Okay, Ms. Cram, how about number 89, please?
Thank you, Mr. Chair. Yep, the next one that I wanted to talk about is CD 89. So this waiver would allow for lead agencies, so counties, tribal nations, managed care organizations, to obtain verbal or expressed approval of support planning documents that would typically require an in-person signature. So some background on this one. Right now, waiver case management visits and our assessment and support planning meetings can occur virtually or via two-way interactive phone or video. And many people are continuing to choose that remote option. So CD 89 would align with those flexibilities so that the case manager doesn't need to obtain the in-person or what we sometimes call the wet signature on those support planning documents. As part of the assessment process, the lead agency would still have to ensure that, like always, the person is informed of all of their options and that the document that is discussed and that the person provides consent for, that all of those discussions are included in the support plan so that we know and can just assure that the person was apprised of all of their options and did indeed agree. And that's all I have on that one. And I think that's it for our list of COVID extensions. So I'm happy to answer any questions you might have.
The last one seems like not a lot. And just to comment about the whole list, these 6, and there were a bunch of other waivers and some have expired, and we were looking to see how many we should make permanent. And so I think still as COVID, hopefully by the time we get back into January that, you know, we're just talking about something in the past, but there are still good ideas that we thought of in here to make it work more simply. And I just had a suggestion for all the people that hate to see regulations go away. If we create a new regulation that says ignore regulations 94.7, 29.42, and 69.14, it would actually be adding a regulation. So then people wouldn't feel so bad about shrinking. So that's supposed to be a joke, but not very funny. But if people do have ideas about things they've seen working really well with flexibilities, we are running out of workers. There aren't enough human beings. So if we could find a way to make each individual as effective as they could be in their workplace, and we're actually going to run out of money sometime when all this federal stuff was coming, and a way to streamline how we do our interactions. I think that's still a good idea for next session. So any other questions about this segment? Thanks, Ms. Brown. Seeing none. So now we're going to talk about the National Guard response. And unfortunately, we couldn't get anybody from the Guard to come. There was a press release that was passed out just a few days ago talking about this. And so it's Ms. Rydrick, I think you're going to be talking about that.
Yes, Mr. Chair. Yes.
Thanks for coming back.
Yeah, thanks for having us back. So, Mr. Chair, for the record, my name is committee.
We just lost your audio.
Oh, it said the host muted me. That's not nice.
That's so rude. Why would we do that? I would have control.
So anyway, for the record, my name is Diane Rydrick, and I'm the Acting Assistant Commissioner of the Health Systems Bureau here at MDH. And I can just give you a little bit of background on this. We have Assistant Commissioner Pollack from DHS here as well, and we're happy to answer questions. So just to provide a little bit of background, as you know, as we continue to deal with the current wave of cases associated with the Delta variant, we are seeing rates of hospital capacity that are higher than what we experienced in the spring wave. And this is leading to a number of hospitals facing challenges finding beds for patients who need either a medical surgical bed or an ICU bed, and a high number of patients who are boarding in EDs or essentially waiting for an available bed for more than 4 hours, which presents risks for those patients. In our conversations with hospital administrators, we do hear consistently that there are some of their beds that are occupied by Minnesotans who could be treated at long-term care facilities, but for whom they cannot find a quick placement because of staffing constraints on the long-term care side and bed shortages. So last Thursday, Governor announced several actions that he was taking immediately to decompress, is the word we've been using, to decompress hospitals or provide kind of a pressure relief valve to hospitals by increasing capacity in long-term care and allowing some of those individuals who are ready from a medical perspective to move to a step-down setting to be able to more easily find a placement. So among those actions is an expansion of the emergency staffing pool that's currently being used by DHS to provide staffing support to facilities who have COVID outbreaks, to include additional staff who could be deployed to those decompression sites and nursing homes to allow them to take additional patients who are ready to leave a hospital, but who are not yet ready to go home. He also announced that he was putting the National Guard on alert to potentially provide additional support to those sites if needed. What that means is that the National Guard hasn't officially been deployed to long-term care, but they are preparing. They are training their troops so that they're ready if they are needed for that purpose. So on standby, but preparing their troops to take on that mission if and when that time comes when they need to. So right now, MDH, just really quickly, MDH and DHS are working together to identify where those hospital decompression sites would be located. It's a voluntary process. Nursing homes can choose to be a part of it if they want to be, but they are not required to do so. And I think it's important to note that for facilities that do choose to be part of that process, they will be held accountable for following all state and federal regulations related to the care that they provide. And they will be the ones making decisions on which patients that they admit as part of that decompression process. So I'll just pause there. I don't know if you have questions. I would assume you do.
Yeah, I've always thought you're very good. I have a question. Yeah, shocking. And then Senator Nelson is after this. But I just was reading the press release, and there's apparently 75 soldiers and airmen, air persons, going to go do stuff. There's going to be 7 teams at various sites with, it looks like mostly testing, and then some administrative tasks. So I'm just curious, is this going to give any extra capacity to handle more beds? It seems like these are just going to do more testing, which there's already a lot of people doing testing anywhere. So can you, maybe you or Mr. Pollack, understand how this is actually, I don't see this as increasing capacity. I thought you'd be dietary and other things that that they were short of help about, but it looks like this is just more testing and kind of filling in some administrative gaps and not really opening up any more beds due to their presence. Are new beds going to, this is my question, are new beds going to open up because of this help? That's my question. Thank you.
Mr. Chair, yes. So the press release actually announced 2 different roles that the Guard would or could play. And with regard to some of the rapid testing sites that are being set up around the state, the Guard are already playing a role in that process. And I'm probably not the best person to speak to exactly how and where that's rolling out, but we can certainly
that's not my, so yeah, so talk about the nursing home for the capacity. That'll be productive. Thank you.
Mr. Chair, so Mr. Chair, so the second part of it is, as I noted, I think one of the pieces that gets overlooked a little bit in the press release was the expansion of the emergency staffing pool. So we are working with DHS and with the staffing vendors that they already have under contract to find individuals who can go out to these decompression sites, nursing homes that volunteer to play that role. And yes, that will add beds. So we are working with those nursing homes and identifying where they will be and how many beds they'll be able to have.
That's still being sorted out. Yeah, so the press release didn't
to help if needed.
Yeah, they totally left that part out of the press release. Thank you. Senator Nelson and then Senator Hobson.
Yes, thank you, Mr. Chair. I have just kind of three distinct questions, and maybe I'll just put them all out there at once with the most important one, just to save time for the committee here. Number one, let me just say, our seniors remain very cautious and concerned about COVID, even though they have been vaccinated and they have booster shots. It has really made them feel insecure in leaving and in going out. And you know how dangerous that is as people are aging, not to have that social interaction. So that's really been cut short. And what I've noticed is, even though they are vaccinated and have had boosters now, they're still very cautious about COVID. They know, perhaps, that they're such a vulnerable group. And so the first thing that I want to know, and the first thing they want to know is, number one, is someone who has COVID, is in a hospital, and now is part of this hospital decompression and is being sent to a nursing home, are they contagious? And if so, or if not, how do you know? And then, so if you can
let's just take that question
okay.
first. I don't want to. That seems like a good question all by itself.
All right, thank
Ms.
you.
Rydrick?
Yeah, Mr. Chair and Senator Nelson. So any patient who would be discharged from the hospital in even a normal situation, and in this case with decompression sites, it would be an individual who's ready to receive step-down care but not yet ready to go home. And the receiving facility would determine if they can provide care to that person. So they are going to first do an assessment, talking with the hospital, figure out if they can provide appropriate care for that person's needs based on their staff and their capabilities. If there are any patients who are COVID positive, and this is how it would work now already, the facility would have to decide if they wanted to accept that individual, if they could provide care for that individual, and if they could meet all the expectations around protecting the facility against any spread if there was a COVID positive individual. So they would be responsible for following all state and federal requirements related to infection control and prevention, related to isolation and quarantine, related to use of PPE. So nothing about that changes under this model. If a facility chooses that they can accept someone who is COVID positive, they have the responsibility to meet all of those requirements to make sure that there is not a spread of COVID within the facility. And that's no different in this situation. It's up to the facility to guarantee that.
All right, thanks, Senator Nelson.
Thank you, Mr. Chair. Well, that does not give me a lot of confidence, quite frankly. The first answer about the fact that are they able to deliver the care, that wasn't really my question. The question is about, are they contagious? And you did get to that. And this is why it's concerning to say that a facility might choose to accept a COVID positive patient, and then that facility is responsible for following all the state laws and all the regulations and keeping everyone safe. Well, I don't know. I just don't find that is very comforting to the people who don't have a choice, who are living in that long-term care setting. And in other words, is the long-term care facility liable if somebody gets COVID from a COVID positive patient that's been released into their population? I don't know how the entity, the facility, having any sort of responsibility is going to provide any comfort to that senior in that nursing home that now does get COVID, or their families. And so I just find that very troubling. And what does that mean? Would the long-term care facility be liable in a civil court if a long-term care resident got COVID because a COVID positive patient had been introduced into that setting? So I know it might sound, I do not find it comforting to say that they will take on all that responsibility. And it is very concerning to me. And I will tell you, it's very concerning to a number of seniors as well. And while the facility, the long-term care facility, might have a choice about if they want to take that COVID positive patient in and provide the necessary safeguards. Let me just say, most of the members, most of my constituents and residents in a long-term care facility, you know what? They don't have a choice. They don't have a choice. It's not like they're customers that can vote with their feet and say, I don't feel safe here and I'm going to move somewhere else. So I just want to say I am extremely concerned about that. And I don't know if there's any other questions to that point, but I did have.
So take your next question and then we'll move on to Senator.
Yeah.
So one more question.
Yep. So the second question, I'll just do both. They're pretty brief. The second question is, how is the National Guard trained? Are they trained to do this type of care? And we understand that the governor has the authority to call out the National Guard, and they're Minnesotans that I have the most confidence in, but I don't know if they're trained to provide this type of care. And then I also don't know, will they be in National Guard uniform when they're there or not? And how would that make our long-term care residents feel? Would that make them feel safer to have the National Guard there? Or would that make them feel like they're in a more risky place?
Ms. Rydrick, I'm sure if you don't answer to that, but you can take your best stab at it. So thank you.
Yeah, Mr. Chair and Senator Nelson. So you may recall that the National Guard were deployed to long-term care facilities last year in cases where there were outbreaks of COVID-19. So they provided supplemental staffing support to groups to certain facilities during that period who had staff shortages related to COVID outbreaks. And of the groups that went out, some are existing medical personnel. So there are nurses and doctors and others who are part of the Guard who have a healthcare role outside of, in their non-National Guard life. And so some of the individuals who went on site at that time and who would, if deployed in this case, go on site are individuals who are already trained as nurses, as RNs or LPNs. The other troops that went out on site in the fall and that would, again, if deployed here, have received training to be certified nursing assistants. And then they receive additional training on site at any facility that they're deployed to understand specifics about that facility, if there are equipment issues or just kind of logistics or physical space issues that the troops need to understand about that individual facility. They receive additional training at that time. I can check on the question about whether they a National Guard uniform or, that clothing that is more in line with what the facility wears. I believe that they did not wear uniforms when they were on site in the past, but I can confirm that.
Thank you.
Mr. Nelson, is that good?
Yeah, thank you.
Okay.
And that is a comforting answer. And I have the most confidence in our National Guard, whether they're in uniform or out of uniform, but I'm glad to know further training. And Mr. Chair, my final question, and there's not much to say about it. Does the governor have the authority to do this? Does the governor have the authority to do this hospital decompression?
I bet he does. Ms. Rydrick, you presume probably he does, I bet.
Mr. Chair and Senator Nelson, I think we would probably want to have someone here from the governor's office to speak to his role as Commander-in-Chief with respect to the Guard and to talk about
Thank
that.
You. Thank you,
I bet
Mr.
he'd say, yeah, he does. But, so there's an open and standing appropriation. So I don't know the rest. So that's a different question for probably a different committee. So Senator Housley.
Thank you, Mr. Chair. How many of these decompression sites are there? How many, and are they just nursing homes or are they assisted living included?
Mr. Pollack, do you know that, or is it Ms. Rydrick?
Mr. Chair and Senator Housley, I can take that. And I'm going to apologize for my husband leaf blowing in the background if you can hear that noise. Such is the challenge of it.
It is autumn.
Yes, it is. It's always good timing. Senator Housley, we are still determining how many facilities there will be. We need to look first at their capabilities, how many beds they have that are available under their license that they would be able to staff if we provide those additional staff to them. And we need to do our due diligence just from a regulatory perspective and an engineering perspective to make sure that they're ready. The hope is that we would have 4 or 5 of them, mostly in the metro, but then outside as well. But we need to go through that process of making sure that they are ready, and looking at who even throws their hat in to become a decompression site. We're looking just at skilled nursing facilities. Our understanding from the hospitals that we've spoken to is that the greatest need is for individuals who maybe are a few days post-surgical and need to be in the transitional care unit for a short stay before they're able to go home, and that's most appropriate to.
Okay. You're kind of locking up there. Senator Housley, did you follow?
Yeah, thank you, Mr. Chair. Ms. Rydrick, have you heard from any of these facilities that are volunteering? Has anybody called and said we're interested?
Ms. Rydrick or Mr.
Yep, Mr. Chair and Senator Housley. Yeah. Yes, we put out an ask yesterday. We had a conversation at the beginning of the week with the long-term care associations and with several of the provider systems to talk about how we were envisioning this and to see whether they might be interested. We followed up with broader outreach yesterday. We have already heard back from a couple of facilities that are interested, and we are starting that due diligence process now to determine whether they will be ready.
Thank you, Ms. Rydrick. Mr. Chair, follow up. How many members of the National Guard are you anticipating that'll need to be deployed? And in addition to that, you mentioned that some of them are already doctors or nurses. With such a shortage of nurses right now, isn't that kind of robbing Peter to pay Paul by moving them from a hospital setting over to a decompression site? That I got that question from one of the nurses. So I'm just wondering, does that make sense? So how many members do you anticipate, and does that make sense to be taking them?
Yeah, Mr. Chair and Senator Housley, we too worry about the robbing Peter to pay Paul question. And it's an issue that comes up whether we would use the National Guard or whether we use staffing companies. And, we do try to follow a last in, first out approach with the National Guard, just knowing that it is a big ask of them. So we are looking first to staffing companies and seeing if we can fill the need based on the number of beds that these sites can make available. And then we'll fill in with the Guard if we need to do that, if we can't find the staff in another way. So I can't answer the question about how many Guard there might be until we know the size of the gap that we might need them to fill if we can't find other individuals to staff. But that question, are we pulling from other sites, other facilities, is very real. And it's something that we think a lot about, both as part of this process and as part of the larger solutions that we've been talking with the long-term care associations about. Anytime you try and bring in temporary staff or surge staff, wherever they come from, they come from somewhere. And it's an issue that we are all thinking about and really trying to guard against where we can.
Senator Housley.
Mr. Chair, then my last question, I'm sorry. So the governor announced this 5 or 6 days ago that he was going to do that, and then that was it. And so I'm still seeing there's not a definite plan. So he announced it without a plan. What is the timeline that you're seeing on this? So you have to do some more due diligence, but what is the timeline of this? And that'll be it, Mr. Chair.
Thanks, Mr. Wright, Ms. Rydrick, or Mr. Pollack, whichever.
Yeah, Mr. Chair, Senator Housley. So the governor announced it last week and announced the outlines of the plan, including what we are doing right now, which is using the emergency staffing pool and then having the Guard on alert and starting to do their training of their troops, which takes a little bit of time, and we need to respect that timeline too. We have a meeting today with one of the possible decompression sites, and we're talking daily with the vendor that's doing recruiting as well as with the Guard to see if we may need them. So I think we are very near to most likely having the first site identified, and then we'll identify the others after that as they make their capabilities available and as that recruitment process continues. So what was announced last week laid out the general approach, and we've been working to operationalize it over the last couple of days.
Senator Housley.
Thank you, Mr. Chair. I actually have one more question that came to me. So I'm guessing that some of these temporary staff for the compression sites might be coming from long-term care. And the long-term care providers are worried that you're probably going to be paying more than they're paying. Is there anything in place, or could you make sure there's something in place that, because that causes a whole nother problem if they're going to get paid more by going to the decompression sites than they are over in their long-term care setting?
Ms. Rydrick?
Yeah, Mr. Chair and Senator Housley, I may see if Assistant Commissioner Pollack has anything to add on that, since they've been.
Mr. Pollack, you're back on the hook.
Thanks, Mr. Chair.
Yeah, sorry, Dan, go ahead.
Let him go. Yeah, thanks.
We started with a music choice, and it's Bob Dylan. You know, it's
Oh,
how many
okay.
roads
Thank
can
you.
we walk down? This feels
perfect.
very circular, and we've been here before. And you're right, Senator Housley. We're in a crunch, and I would be remiss to say we're not going to take any of the good employees that we have in our current long-term care sites. But the reality is, the hospital decompression issue is, that rises to the top as the most vital, urgent need. So we're going to be really careful and considerate with that, and encourage the vendor to not be poaching or anything like that. We've talked to the providers a little bit about what they would like to see as far as people returning to jobs when this temporary activity is done. That's totally appropriate. And we're going to try to do our best to pull in new workers, obviously from other places as well. But there are licensing issues, there are regulatory issues that we want to be cognizant of, and so we've got to balance all of those. I'll just add, we are looking. This is not an enormous new pool. This is about 50 CNAs and roughly 25 nurses that we're talking about. We think that's probably in the range of full-time shifts for roughly 200 beds, like Assistant Commissioner Rydrick described. So it's not that there would be thousands of people coming off of a different job.
Thank you, Senator Housley. Did that get you there? Okay. And I'll just mention the word vendor. We're running kind of overtime on this segment, but I just find it novel. You have to get a vendor to get people like this. So I'll just leave it at that. Senator Wickland.
Thank you, Senator Abler. Yeah, just a couple quick questions. I just wondered when this invitation for facilities to kind of request assistance went out, is it an open-ended window of time that they have to respond, or is there are there any kind of constraints on, they need to make a request within a certain time frame? And then the other question I had, it's more to the longer term staffing issue. I'm just wondering if people in the industry or within the agencies are working with any of our training locations or higher ed institutions to see, are we able to accelerate training of additional people in the CNA roles? I think that's probably the shortest training cycle needed. And it seems like if we could use some, input to higher ed to find out, is there any way that we could accelerate or incentivize people to go through those training programs and then become eligible to work in some of these facilities? So those are my questions. Thank you.
Senator Wickland, I think you've just outlined the ongoing problem with all these direct care circumstances, that how do you get people to want to do it? So I don't know, Mr. Pollack, you want to comment on that? And then we'll let Senator Nelson ask just a short question, then we'll move on.
I'll be really brief, Mr. Chair. Senator Wickland, the invitation just went out yesterday. It's just a very short form that we're going to get to as many of the providers as possible who we think have large scale capacity to respond quickly and do this in a safe way. The longer term idea that you propose, I think it probably is its own hearing, Mr. Chair. There are a lot of efforts at DHS and MDH to do the kind of training you're talking about. And I think we probably even have some of the new funding options and the federal dollars with enhanced Medicaid rates that could be used for the kind of workforce development idea that you're describing. But probably too much for today.
No, that's perfect. Thank you. I think this is very instructive, and just given that even the press release didn't include anything of what you said, that's kind of nice. So thanks a lot. I think it's been a productive segment. Senator Nelson, you can just even make it a profoundly cool segment.
Sure.
Thank you. Thank you.
Yep. I'll be very short. I appreciate the conversation. And also working on that workforce shortage issue, and be glad to share some things that are happening in that regard regarding nursing tracks and CNAs later. But I just had a question back to the location, back to that physical place where the hospital decompression will be placed. And I remember earlier on in our COVID conversations, we ran into similar issues where the hospitals were filling up and there weren't enough intensive care sites for this. And if I recall correctly, we at that point initiated, I don't know how it turned out, but some of the hotels who obviously were facing no customers really during full shutdowns, and very little even after those shutdowns. Some hoteliers, and I spoke to some of them, who did participate in being a site, which I guess you would have called a decompression site at the time. I hadn't heard that term, but COVID patients were released to those hotels as safe places to be, keeping others safe as well, with the necessary services. And I'm just curious, was that looked at now instead of releasing the COVID patients into the long-term care facilities? Was that part of the discussion, or were you part of that discussion using the former model, which was allowing hotels to choose to participate to be a decompression site?
Whichever one of you two. Please.
Mr. Chair, yeah, let me take that really briefly. And Senator Nelson, that is a really good point. And what you're describing is a slightly different form of decompression. What you're describing is actually something that was done for homeless shelters, where people who might have tested positive for COVID were sent to a hotel space to be isolated from a large congregate living environment so that they wouldn't spread COVID further. I don't think that that would be appropriate for somebody coming out of a hospital. The care needs and acuity of somebody coming out of a hospital are going to be higher.
Thank you. Thank you,
thanks.
Mr. Chair.
All right, appreciate that. Well, I think this is productive. I just have just one more question. So the 200 beds, are we still a month out from this getting implemented, do you think, Mr. Pollack or Ms. Roderick, or is it going to take longer than that? I know training doesn't happen. I don't know how long training takes to be a CNA, but either one of you, please.
Mr. Chair, I would say I don't think that we are a month out. I don't think they will all the beds will come online at once. So we're going to be looking at sort of what is the right time in each facility based on their capabilities and how quickly we can get the staff out to them. The hope is that we have the first site that we're already in discussion with, which is a fairly large one, ready to go very soon. We are a month out. I think the capacity will come online over the course of the next few weeks.
Well, thanks. I was wrong about the batting cleanup. Actually, Senator Nelson was on the blue line. She just passed the puck off to forward Senator Housley, who's going to ask a question. So,
wow, we're going to switch to hockey analogies now.
I thought it made sense.
Taylor, I didn't know. Okay, so I'm a little concerned here, and I just want to make sure that this doesn't happen. But it sounds like, Mr. Pollack, I heard that you're addressing
I think you froze, Senator Housley, based on mine.
Isn't that the Frozen Four? Since you're doing your hockey analogy. Senator.
Oh, yeah, that's funny. Senator Housley, are you there? Is your screen moving? Now you went dark.
She might just be shutting off her. She might just be shutting off her video. Give her just a minute.
So the hockey thing, that was probably a bad idea. It's not the curse of the Bambino if we do hockey.
Well, Mr. Chair. Mr. Chair.
Yeah, well, we have another question from Ms. Why don't we just change to the next topic and then we'll come back.
Can you hear me now?
Are you there, Karen?
I have no idea what happened. It's just like the Zoom closed down. Anyway, it was for
Yes, so
Mr.
start over.
Pollock.
We didn't hear most of what you said.
Okay, it was for Mr. Pollock mostly because I heard him say that the priority is with these decompression sites. And I'm very, very worried and concerned that they're going to be taking workers from these long-term care sites when we've been screaming at the top of a mountain for the last 20 months that we are short in long-term care settings for workers. 23,000 is how many openings they have right now. And the workers there are double shifting. They haven't had a break in months. And they're losing them daily because they're just so exhausted. So I just don't think to prioritize these decompression sites over the long-term care setting is the right strategy. So we can talk about it offline, but I just want to make sure that doesn't happen because our long-term care settings are really, really hurting. And if they hear or see that they're losing workers to these decompression sites, which again, I heard are prioritized over the long-term care settings, it's going to kill them. So I just can't stress that enough, Mr. Pollock. Thank you.
Well, let me just offer a thought too. And so I will just opine something. A lot of these policies that have come through COVID, the emergency orders have all been done in one office with a few commissioners or staff announcing to the world what it's going to be. The press conference didn't even have you mention much of this part. So I would just urge the administration, including the governor and the commissioners, to talk to the leads on these committees, particularly Senator Housley, who's got a whole committee dedicated to this, and that you talked with the not just a couple of the nursing home like government relations people, but there's a real dialogue here. And so I wasn't even going to say that till I got to this last piece here. And now there's a vendor, and the vendor's going to get paid for recruiting, and that's even wondering how that's going to work. So. Senator Nelson, can you be brief with your last comment?
Yes. Thank you, Mr. Chair. Just real briefly, just to close the loop on this, when a COVID patient is released or a hospital decompression patient into a long-term care facility, are the residents notified? In other words, is there a notification that there has been a COVID patient?
Mr. Pollock, do you know the answer to that? I would bet not, because it's private data. But Mr. Pollock, do you know?
Mr. Chair, why don't we follow up with Senator Nelson, maybe with MDH licensing staff? I don't want to guess at an answer.
No, I got that. So, but I think, and just my advice to you, we want this to work. For all the governor's rhetoric that none of us care, a lot of us really care. A lot of us are very well intended about this. There is no avenue to communicate to that office that works these days. And so I hope you hear, particularly the lead in the Senate, that I would work with Senator Housley and her lead. I just come on. Anyway, on that,
Senator Egan,
thank you. It's just senior moment here. But I think working with that crew and then Senator Schultz and whoever the lead in the House is would be really a good idea to get ownership of this and actually make it even better. And I think the time for these for these one person thinking of things, we're not in emergency powers anymore. Here we are, we said we want to help, and the phone never rings and the email doesn't come. I never got the letter about the COVID requests and so on like that. So but I just think this is a time for that. And I'm sure you can carry that back. So I want to thank, this has really been an interesting segment and very important. And so I hope that the two of you can carry back our sincere interest in working on that. So thank you. This has been very interesting. So Ms. Rydrick, I know that, anyway, this is the third time, welcome back on this topic about what's going to happen with the Biden mandates to nursing homes and to the care facilities. And I know they haven't released the guidance yet, but please, can you tell me what you know on timing wise and anything, please? Thank you.
Mr. Chair, I wish I had more to tell you than I do. We initially thought the rule would come out in September. Then all we've heard is October, and we're in late October and we haven't heard anything. The skilled nursing facility Grapevine says that it's coming soon. It's under review, but that could still mean it could arrive today or it could arrive in a week. I think the other key thing is we still don't know what deadlines are going to be set when the rule comes out. They may release it next week, but say that people have to have their first dose or be fully vaccinated at some point down the line. And we don't know when that is. It's been frustrating to be as in the dark on this as we are. And I know that it is for you too.
I respect that. And I'm not trying to, well, I am trying to badger you, but it's not really working. So that's not productive. But so when these rules are, like when we have rules, there's two different rule processes. There's expedited and then the regular time, and either one has a chance for public comment. Is there going to be public comment on these rules and a period for that so then people can know anything, or are they just going to, here they come with a signature on the bottom? Do you know that?
Mr. Chair, I do not. I know that for some new requirements that CMS has released over the last year, they release a rule and then it goes into effect immediately. So I think it's at least reasonable to expect that it will go into effect immediately. But again, what it may say is that a date in the future is when it is effective. And so until we know both when it's released and what it says in the rule about at what point accountability measures kick in for facilities that don't have their staff vaccinated, it is both of those dates that matter, when it is released and when it is actually effective for the facility. And we don't know either.
And I appreciate that. It's just, I can't imagine, I mean, even the word health facility is not very well defined. And so at least as soon as we know that definition, then we can treat a clinic that they don't have to worry about it. I think right now they're all worrying about it. And I hope that someone has thought about the unintended consequences that a facility may actually decide not to take Medicare and Medicaid in an effort to avoid that particular mandate. And now they don't have a federal connection to anything. They can just live their life and serve people, but while depriving others of, Medicare benefits, which would be just clumsy. So any questions from members about this? I just have one more comment. And you have no idea if there's going to be religious exemptions and so on for that?
No.
Yeah.
Mr. Chair, no, we do not know.
Yeah. I just got an email just before this meeting. A pastor wrote just about this and decrying that the religious exemptions are being not allowed for in some cases. He just mentions that people are being bullied and ashamed. Then the most interesting thing I wanted to just bring up to people, which I thought was pretty cleverly written. He said, in the past, it's been necessary to appeal to lesser authority when the higher authority is ruling against established laws and against God. And so I actually thought he was going to say that God is a higher authority, but he just was talking about political authorities. But I think there are some people who very sincerely do not believe this is right for them. And it's just, this is my first pastor letter, which is why I thought I'd bring that up. And just on a follow-up thing, I got an email today from a person who works at Olmsted Medical Center in Rochester. They've refused all religious exemptions, which I think is tragic. She says Mayo's trying to get the unvaccinated to resign, and then their supervisors are telling them that religious exemptions won't be approved. And I was really proud of Mayo, how they were being so open-minded and reasonable and fair with their staff. To me, just so you know, you've got a nerve going on me that people came to this country way back in time for their faith. And we are a pluralistic country, which is so people can worship God or not worship God in their own ways and have their beliefs. And I'm just very concerned, and I don't know where to go with that, but I thought hopefully the Biden administration will see remembering our heritage about that and give people the privilege of their beliefs. So anyway, I hope that was okay. I said all that. I just don't know how to not say it. So Senator Nelson, please.
Yes. Thank you, Mr. Chair. And this is a very important topic. And I'll just say right off the top, I'm a Republican that believes that the vaccines are a modern day medical miracle. And so I've chosen to be vaccinated. But, we would hope that and hope that others do too. But the point is, it needs to be a choice. And I think that's what we're getting at here. And what I'm hearing about exemptions raises a couple questions and a couple concerns. One, if there's a federal mandate, as the Biden administration has put forward, every state has different vaccine exemptions. And so how is a federal mandate at the federal level going to honor those exemptions that are probably different in different states? And then the other is we have vaccine exemptions in Minnesota state law as well. And we have a list of all of those. And I realize they're different for different entities, whether they be higher educations or schools or those type of things. And it seems to me that our laws are regarding vaccine exemptions are still the law. And so I think that's an important piece for us to consider too. But I don't know if anyone has any discussion or comments on
Ms. Ryder,
the
you know the
Biden.
answer between the federal, what a rule is going to do to our various state laws and even religious things. Do you know offhand that? You know, I know we're pretty on the spot there, but go ahead. Your screen just went to black.
Yeah, Mr. Chair and Senator Nelson, this care providers, it's going to be a rule that comes from CMS that is related to, conditions of participation potentially in a program.
Mm-hmm.
And so I think there will, I'm sure, be questions about how that relates to local laws. I know that we're seeing that play out in Texas right now, where I believe they may have passed a state law prohibiting employers from having mandates. And now some of the skilled nursing facilities in particular are not sure what that means for them, with a federal mandate coming along the line sometime soon. So I do think that those questions will come, especially in states that have taken a stronger position against vaccine mandates.
Thank you.
And I mean, every segment of this hearing is taking longer, but I think we're having a good discussion. I think it's healthy that in a hearing like this, we can show that we're interested. And we had Ms. Tiedemann come last time. I didn't know, she just signed up. I didn't know her before the hearing. But I think it's really important for you as a department to understand there are people who are just simply not going to get vaccinated. And for any number of reasons that are very valid. And there's a lot of debate about that. But I think the benefit of her testimony, which I did not get from some of the comments afterward that were posted around, was that just understand the depth of people's passion about not getting vaccinated, and to know as a policymaker what is going to happen to some of these facilities when that requirement goes forward. And so anyway, thank you. I hope we were, that's a good discussion. So let's move on. So now on a whole different change of pace here, we're going to talk about the payroll protection money. And Mr. Pollack, I don't know if you have a presentation, but actually given how time has gone, if you can just, the question has arisen, what happens to the treatment? How is the payroll protection money that was given to nursing homes and other facilities treated with regard to their rates? And you'll be able to tell us that. It's a timely topic. We don't have to complete it today, but I wanted the committee to be aware of it. We are a finance committee and we're charged with nursing home financing, et cetera. So, and there seems to be some dispute about this. I don't know if there's testifiers besides you, but go ahead, Mr. Pollack.
Thanks, Mr. Chair. And Val Cook for the Nursing Facility Rates and Policy Division from DHS is here with me as well. I don't have a prepared presentation. I actually think we were maybe here for Q&A and that there was a different testifier to present. I'll just say really briefly, it's exceptionally complicated. You and I have talked about this intersection between where does federal, COVID assistance show up and what does it mean for a cost-based system? You have told DHS, you have told us in state law that you want us to account for every dollar of federal revenue that the cost-based providers receive. And so we are doing that. We are going to work to stay in compliance with state law the way that the legislature has written it. And that gets very complicated when you have constantly changing deadlines on reporting and different requirements for federal assistance versus state assistance. And so we definitely sympathize with how much what the providers are feeling in terms of the challenges here, and obviously want to keep talking to them about that.
Right. Mr. Brennan, is anybody here from the nursing home side, from the imperative Do you know that? See, Ms. Gleason has raised her hand. So.
Yes, Mr. Chair. I am a nursing home provider.
Okay.
I don't know if this is my time, but
well, this is right. Actually, if you could just step back a little bit, and I can just see we're not going to exhaust this topic today, but I think I wanted to raise it to the attention of the committee that there's even a concern from you all, and so if you could maybe give us a 1-minute tutorial on what a credit is and how it gets knocked off your rate, and how maybe you think that this shouldn't be considered a credit. Did I say it pretty short?
Yes. I will do my very best to condense it to 1 minute.
Well, no, just tutor us on that and then say what you want to say. So.
Sure. Okay. Yep. I prepared something brief. I can just kind of go through quickly, and then I'm open to taking questions.
Yeah. Can you screen share that?
Yes, absolutely. Thank you.
I know I couldn't, but I appreciate you doing that.
So my name is Jennifer Gleason. I'm the Chief Operating Officer at Living Services Foundation. We're a small nonprofit providing nursing home and assisted living services in Mora, Minnesota and Minneota, Minnesota. We employ approximately 220 people through both locations. Both of our nursing facilities accepted Paycheck Protection Program loans in April of 2020 and again in February of 2021. Additionally, we received provider relief funds at both sites. And obviously, I think we all know for a small organization like ours, the pandemic created significant financial uncertainty. So I want to talk just briefly about how we've been spending that money over the last 20 months. And then just get into, what that means for future rate years, depending on how the state of Minnesota looks at those costs. So first, there was a substantial impact to revenue. By June of 2020, we had seen a significant decline in admissions as local hospitals stopped conducting elective joint replacement procedures and other non-COVID hospital admissions declined. This decline caused our revenue to decrease by about 25% during the third quarter of 2020. While revenue declined, staffing costs did not decline at the same rate because residents were isolated to their rooms. They needed additional staffing hours for meals, cares, and activities. Additionally, we were mindful of keeping all of our staff employed in preparation for a possible outbreak that would limit staff availability. Our nursing administration overhead grew as we spent time processing the continually changing guidance, training staff, communicating with families, and dealing with near constant issues related to staffing. As we moved into 2021, we've seen pandemic-related shifts in the labor market that this committee has been discussing already today. And we've needed to raise wage scales for positions across our campuses in order to retain our workforce. These costs are not easy to extract from our normal operating expenses, nor have they gone away as we move closer to 2022. Obviously, we did encounter, direct costs related to COVID that are more easily, separable from, a typical year. Those included PPE testing, nurse consulting costs. We paid bonuses related to testing, vaccination, and hero pay to every employee. We also made a decision that any employee who believed they had been exposed or had a symptom was to be granted paid leave because we didn't want any employee to choose between financial hardship or the safety of our residents. These costs would be difficult to manage, even if we didn't have the substantial decline in revenue I spoke about a few minutes ago. The PPP and PRF funds have been utilized to help our organization stay afloat, and they are rapidly disappearing. Yet for us, it does not feel like the pandemic is winding down. We're still concerned about breakthrough infections, vaccination rates, industry census being slow to rebound, as well as the incredibly tight labor market for nurses and aides. We often refer to nursing homes as cost-based, which implies that the state of Minnesota pays the costs we incur, but the reality is more nuanced than that. Under the current system, our costs are divided by the number of patient days at our facility, and that cost per patient day is used to set our rates. There is an assumption built into the system that our occupancy will remain stable in order for that rate to cover all of our costs going forward. In 2020, when our occupancy took a big hit, small organizations like ours needed cash to fill the gap between our planned overhead costs and the decreased revenue, as well as cover the additional costs required to operate during the pandemic. The proposal to remove the expenses funded by PPP and PRF from our future rates presents a significant problem for us, as those funds covered items which were not one-time costs. For example, PPP and PRF funds have been used to cover wage increases for our staff as labor shortages push the market wages up. We do not expect those costs to disappear when the pandemic ends. And if the state is excluding those costs from our rates, we will have no way to cover them moving forward. Subtracting federal relief funds from our costs, as well as not raising the limits set on direct care costs in the cost-based system, will create hardship that will potentially make it very difficult to continue operations. The last 20 months have been arguably the most difficult months nursing homes have ever faced, but 2022 will be as difficult if our rates don't cover the costs needed to sustain our operation in these rapidly changing times. Thank you, and I would welcome any questions.
Well, that's very interesting. Do you know, I realize you're representing, your own site there, and Mora is an amazing little town. We used to have a little cabin up there and the pretty lakes and all, but and then there's a bakery and I think even 2 hardware stores, so good place to raise your kids. So do you have an idea how much industry-wide in Minnesota the PPP money amounted to that is in discussion here? You don't have to know that, but do you have any idea?
Unfortunately, I don't. Between the 2 loans, our 2 facilities took in about 2.6 million in PPP loans. That includes both April 2020 and February 2021.
For 200 beds.
Yes, but
so
I
obviously, money. It's real money.
Very real money.
And so, how many beds do we have in Minnesota? You know that? Because I'm not trying to stump you. I just don't.
Yeah, no, there are, about 360 facilities, give or take.
Yeah.
So I'm not sure exactly how many beds.
Yeah, I think we have like 40,000 beds. That may be right. Anyway, so it'd be 200 times that. So it's maybe we're talking about $400 or $500 million, maybe. Anyway,
and not
so
every
this
facility,
is a real hit.
Not every facility would have qualified because you had to. There was a maximum number of employees a company could have in order to qualify for PPP.
Yeah.
So because we were small, we did qualify.
I got it. Okay, questions from members. I think that this is the starter of this topic. The department's made a decision that they're implementing somehow or other, and this is, if we change them, it's going to be a law change. I can't imagine it'd be done in time for a special session, but it's certainly worthy of discussion. Unless you tell me otherwise, we can put something together if that's our will. Questions from members? Who's that? Senator Wickland. There you are.
Thank you, Mr. Chair. Just a question, and I don't know as much about this topic, so I don't know if it's a reasonable question or not, but I was wondering if anyone from DHS is available or could answer the question about has our development of this cost-based system, when it was developed, was there any discussion or thought about extreme situations or situations that happen outside of what we normally think is going to happen, which is not a pandemic? Was any of that considered in the development of our rate system? And then have you had any discussions about how this situation is playing out, with the way our system is designed and in statute right now?
Sure, Mr. Pollack, probably.
Mr. Chair,
go ahead.
I do think Director Cook could probably take this on, but I just want to say one really quickly. We have responded on an emergency basis to nursing facilities since the start of the pandemic. We've used the commissioner's full authority for what's called emergency Medicaid Section 12A responses. What we did not anticipate, what our state law does not anticipate, is overwhelming federal funding responses. So I'll defer to Ms. Cook here.
Ms. Cook, welcome to the committee.
Mr. Chair, Senator Wickland, I'm Valerie Cook, Division Director for Nursing Facility Rates and Policy at the Department of Human Services. I think your question, Senator Wickland, is about in the, what we call VBR, value-based reimbursement, the nursing home reimbursement system, and the design of that, and upon the implementation of that. I don't think that this type of a situation where there's rapidly rising costs that occur throughout a relatively short period was addressed. And so I think that part of the financial pressure that people are describing is a part of that. Costs were incurred. It is a cost-based system. Generally, that's a good thing, but it takes up to 21 months is what people usually call it's the delay from when the costs are incurred until they're built into their rates. And so that is a feature of VBR that I think is contributing to some issues through this pandemic.
Ms. Wickland, Senator Wickland.
Yeah, I guess just my comment, I guess, would be that this seems like a topic that we should be taking up, when we get to session, and we should, or even before, as a separate discussion more on, that, so that we understand that committee members like myself, I guess, we understand the background and limitations of it. So
And thanks for members, not that I want to volunteer all this time, but I spent a little bit of time on the horn with Mr. Monahan, who was very helpful. I'm not going to put him on the spot now to give us a presentation, but I think between the department and him, I think this is squarely in our area of responsibility to judge. I think it's unforeseen. And rather than just make a knee-jerk reaction, include it, don't include it. Some places got nothing. And what happens to those places that got nothing? And some of these smaller ones, maybe they're more vulnerable because of their size. Anyway, I really appreciate that. I'm going to put this aside unless anybody else wants to say anything. But I think I wanted to bring it up to call attention to members and various public who's paying attention to this. Sometimes these decisions, there's a law written that made sense when it got written, and sometimes they don't make. A lot of laws didn't make sense in this last couple of years. So Ms. Gleason, I think you were very good with your descriptions. Gets us on a good start, and I think if we do get together and talk about group home staffing issues, maybe we'll add this on. So with that, thank you very much.
Thank you, Mr. Chair.
Yeah, this was great. And thanks for all the work you all do just to keep on with this. And if we're going to drag this out longer, we'd say, hey, do you want to be one of those overflow facilities? But we're not going to do that for you. So,
I'll talk to you.
You're welcome. Yeah, anyway, thanks for being here. So Senator Utke and Senator Hoffman, you've been working on this subminimum wage working group. And for the people who are following this, I was persuaded that it needed a little bit of work done on that. And so they've had a couple of meetings. And so I think Senator Utke, I'll call on you first, and then Senator Hoffman, you can be ready to play off of that. So Senator Utke.
All righty. Thank you, Mr. Chair. And yes, Senator Hoffman and I, and we also have to include in that conversation both of our assistants, Kevin and Tom, that have participated and provided us a lot of assistance, a lot of help. And then we did have one meeting with the advocates, people interested in this 14C. And so we've, with that, have come with what we will have as a few offerings or suggestions. But we do realize that all we're going to, probably get at this time is baby steps, but we still want to take and have some input so that if we get the opportunity to make changes to this before it starts here in January, we would like to do that. And I'll highlight a couple of the things, and then we'll get Senator Hoffman to jump in too. But of course, this all goes back to, we're talking about 7,000 individuals here in Minnesota that the 14C or the subminimum wage topic affects. And so, that's what this conversation is all about, is protecting them, protecting their employment that they want, and then, being able to maintain something, whether it's still called 14C or if it's something else. The name isn't as important as just making sure that what they love to do and what they are doing. And, it's not only their job, they're working with their friends. We don't want to see that eliminated. So, but this all revolves around the task force that was in the language in the omnibus bill that passed back in June. And a couple things there that we would like to see, or that would, we think, add a few additional voices to the actual task force, and that is to increase this work group up to no more than 20 people. It was at 16. So, and with that, you've got one or more that could be someone who is utilizing the subminimum wage services currently. We've got some of those that have reached out, I'm sure, to all of us. I know I've had that, and they can talk about what they've got or what they're experiencing and how they use it. And then, bringing in some additional advocates. As an example, we've had conversations in our last meeting from the A-Team. You've got other organizations like that, bringing in parents. But anyhow, just in giving, 4 more spots to bring in some voices from that side, because it really, I think that was missing in the original sketch of the task force. And then there was a little bit of language, I believe, that needs to be addressed. First of all, I've seen the application online, and it's basically saying if you wanted to sign up for this or to be considered for this task force, that you agree that you basically, as I read it, you're signing up to help move us away from 14C, where I should think it should be more, we're here to discuss or dig into this 14C and who it serves. And, maybe it could be, how can it be improved or whatever, but I don't think it should just be laid out as the elimination. And so some of the wording, we understand that the current language of the task force regarding phasing out subminimum wage can be confusing due to its wording. It may be worthwhile to adjust it to make it clear that recommendations and plan are due by August 1st of 2025, not the phasing out by 2025. And that big part of it there was the recommendations and plan. That's how, we've been approaching this, is it's looking at it, should there be changes and what would that plan be, rather than the phasing out. I think that's the part that's pretty toxic to a lot of our people that are strong advocates. They see it as this is just a way to eliminate that, and that's not what we want to see. And with that, I'd like to, I'll be quiet here and let Senator Hoffman jump in and add whatever he'd like.
Thanks, Senator Hoffman.
Thank you, Mr. Chair, and thank you, Senator Etke. Paul pretty much laid out what the conversation was about, Senator Abler. But, and the other thing too, as we look at this going forward, there needs to be a complete examination. Let me just back up. We do know that of the providers out in the state, 75% of them are not currently utilizing, and that's give or take, a few percentage points, currently utilizing a special minimum certificate, otherwise known as Senator Recchi says, a 14C certificate. And so the challenge is how do we help the other ones move into a direction? And yet the one thing that came out of our discussion, Senator Abler, is a lot of times when the systems make changes in systems, they always do so with good intentions, but there are always people that are left behind. And I'll tell you what, working with Senator Utke, we were specifically wondering, what about those folks that no one's really talking about? What are we talking about when we're saying that somebody has an informed choice decision that they made, right? I'm making this informed choice. What are we doing to support that, and how we're doing to support that, and what that looks like? We don't have the answers to that, but to let you know, Senator Abler, we're not just making a broad stroke assumption, right, Paul? I mean, we're absolutely saying, well, what about? It's that higher level question that's there. And so I think what you need to really look at, and what we talked about, was that complete examination of the existing employment and services provided by those defined in subsection 14, right? And that, it's got to be looking at what are they doing well? What are the opportunities? What are some of the threats that exist there? Looking at those folks that are served currently in that special min employment and services, right? Just so we know, I mean, who it is that we're impacting here. And then, I don't know, you can look at the wage of the examine the range of wages that are paid, right? And then also the employment opportunities. Because if you just make a systems change and you don't think about what if you leave somebody out of that ability to do something that they are liking to do, whether it's a social environment or not, right? If that's their choice, Senator Abler, then what? You gonna graduate to the couch like some other states have done, which is, I don't think we want that. We want to make sure that we're having people as ready for the workforce or ready for life as what they choose as independent, right? And so keep looking through that. And the charge then of the group is to really look at the market, rural, suburban, and urban areas, right? What are there? What are some of the ADA requirements, the barriers, the assessments? Paul, if I'm missing anything, we could do that as well. But there's a full group of options that people should be looking at. And what I really challenge is, we're not here saying we are going to do something. What we're saying is, provide us with information about what we should be doing, right? We're making all of our assumptions based on our assumption that the feds are going to do something, right? Well, this all of a sudden becomes a best practice conversation. And if the 75% can help the 25% achieve that without doing what Paul Utke is saying, right? Don't forget about an individual who's saying, I want to do this because it's my choice, right? How are we going to support and validate what that person is about? So I think those are probably in a nutshell what we did and what we have for you, Senator Abler. And
I appreciate it. I think it's well said, and I'll agree with everything both of you said. And so, Ms. Grom, I realize you're there as kind of staff. You're there as a department assisting just with technical support. And this is a Senate work group, and you've been gracious to be a participant. And I'm not even going to ask you my question to reply to it, but I hope that there's a will in the administration to accept the work that's going on here, and further, even as Senator Utke said, even to just redefine the end goal, because I think the idea of having it disappear by then is probably premature, or maybe not a good idea at all. So I don't want anybody to comment about that, just to put them into a box. But so Senator Utke and Senator Hoffman, if you can, I hope with the work group you've got and the various players you've got a pretty good assembly of people that are talking to you, the advocates on both sides of this topic, and there's actually multiple sides. So if there's a way to reword that, I think we should try to ask for that and see if we can get a consensus around that. But I think absolutely, we certainly want to get a consensus around adding more people and having more representation there, and then making people be on that committee that think that we should talk about it but not eliminate it. I think that's important. So Senator Utke, I'll give you the last word.
Thank you, Mr. Chair. And I don't really have much more to add. Just that we will do, like you said, we'll put this together. And I guess I see it as, and I know that you've had a part in it too, where you've put together which you would like to see as an amendment. I think we should draft that up this way so that it's ready for whenever, so that you'd be able to work with it. And If we get more input, we'll bring it back to you.
So Senator Utke, my amendment was just a good idea on an afternoon. The amendment that I'd like to bring forward be the one produced by your group. And so I waive all rights to that old amendment, which is getting dustier and moldier by the day. So what we're accomplishing here, hopefully, is bringing in the dialogue we wish we could have had during a COVID special session. And so that's my interest. And hopefully, as you've done your work, that the House and the administration will see the value in that and the inclusivity and the heart toward, progress, but not causing any harm to the people who we're trying to help. So thank you very much.
Thank you.
So let's move into the childcare thing. I'm just joking here. And I'm going to exercise a prerogative here. I did ask the department to come up with these this very long and inclusive report on public investments through COVID. There's no way we're going to give this justice today. So I'm going to limit discussion on this just to an update on what changes were made in the granting process. But I encourage members and the public to look this over. And if you have other questions that are not covered by this, ferret them to my assistant, Tom, and we'll get those kind of consolidated to the department if people want even more information. But this is very interesting. And so really well done. So knowing how a lot of DH staff would prefer not to have to testify in front of us. So thanks. But if we have a will, if we do meet again, we might take up a few questions about this, but that's clearly we're running low on time for that. So I'm not sure who the official testifier is about that, if it's Ms. Brown. So if you can just tell us in brief, we had quite a lengthy discussion and testifiers. Oh, I also want to point out that there's a couple handouts that came from, what do they call themselves? The Minnesota Association of Childcare Professionals. 2 items, a letter that I encourage people to look at and consider, and then some concerns expressed about federal guidance and how it might not have been followed. And again, I'm not going to dig into that today, but I encourage the department to please look this over, and I would like a reply from you, Ms. Brown, whoever does that sort of thing, to go point by point and show me how you consider those things. I think that's really important. And again, best done offline. You can take the privilege and study those concerns. They just all came out. Everything came out real quick here. So with that, Ms. Brown, welcome to the committee, and your job just got a lot easier. So
it certainly did. Thank you. So Senator Abler, members of the committee, I'm Tiki Brown, Assistant Commissioner for Children and Family Services at the Department of Human Services. And so was asked to come back after hearing of this committee on October 6th. And so I'll focus and narrow down my prepared testimony really to discuss very briefly what we were asked to consider in that last hearing. And so at the last hearing, the department was asked to consider changing the formula used to establish the Childcare Stabilization Base Grants. And after that hearing, leadership at the department considered the options for a potential change. Upon review of the statutory language and upon review of the data on the negative impact the change would have for grant amounts under year 2, we have decided to keep that formula as originally established. As mentioned before, the department is in the process of establishing financial hardship grants. These funds will be more flexible to providers who are at the greatest risk for closing. DHS has set aside approximately $70 million, which is 25% of the stabilization funds for hardship grants. Now, prior to designing a hardship grant program, we will engage with providers to learn about their needs, their concerns, and their preferences in implementing these grants. And again, as you mentioned, after the hearing, we were also asked to provide additional detail. As you mentioned, we have 2 handouts that you referenced that we're happy to respond to any questions at a later date, as you mentioned.
Well, thank you. And so, part of the beauty of not having to talk about all that stuff is you don't get people mad at you on both sides. Just so whatever I did last time, people in both camps were mad at me. So I feel like I'm onto something here. So I thought that was really interesting. And I want to make it clear that the centers, I support centers, they're necessary. And the reason I just didn't know how much money everybody got, so that reports an update to that. And neither of the proposals took any real money away in the first year. But people have to remember, this is one-time money. So if you're a center, or mostly centers are raising wages. So if you're going to raise wages $3, somebody said, it's one-time money. And so it's going to run out in 18 or 20 months, and then you're going to have to find a way to pay for all that. And so I'm cautioning you about that. I would personally use bonuses as opposed to pay increases, but there was no intent to cause any harm there. It's just that and actually those numbers have actually increased a little bit in terms of centers, and I don't know how that even happened, but so that's really good. But the licensed home are on a continuing downslope, and particularly having heard from Senator Utke and others in greater Minnesota, it's really approaching crisis proportions. So when you get some, so I'm going to urge you in the kindest but strong way that I can to please engage with a lot of those people, especially in greater Minnesota, because they feel as though they've not been very well engaged. And I know you intend that. I know how hard it is to engage them, but to truly listen to that. And so I'm concerned. I'm happy for the centers that are going to keep getting their money, but it's still going to run out. But I'm happy that they're intact, and I thought there was a way to try to accomplish both. So anyway, any comments from members about this? More to come, I guess. And Senator Wickland, and so the city can get even a framework of what you're going to consider to be a place at risk on these other grants you've got. That would be nice. So Senator Wickland.
Yeah, I just want to make a comment that I appreciate the additional information in those handouts, and I will look through that. I didn't have time to review the other two today, and I think that would be great if we do have questions. If I can definitely get those to you, Senator Abler. And yes, I think in terms of the stabilization grants, I hope that the process for the hardship grants will help reveal, a way that we can get money to those who are feeling like they aren't going to be able to sustain their business. And I look forward to more information about the process that they're going to use to develop an application for that. And then the other money, I realize it is one-time money, but I think that what you're seeing in terms of centers raising wages, that is the way that they need to retain staff. And so we should be paying attention to that and figuring out a way that we can adjust or change the early childhood system to accommodate that, because clearly they feel the need to raise the wages to keep people in the profession, and we know they're not paid enough, and that that goes for family childcare providers as well. They need to be compensated better for their work. It's just as important. So, and we do have some other things going on that were passed in 2021 that will be meant to try and address ways to get more people interested in being family childcare providers all over Minnesota. So I hope that we keep discussing those and seeing if those are helping and if there are other things we need to do. So thanks.
Well, I do appreciate that. And childcare there's just so many angles on it. The House has put a committee together for that purpose, and they have time to dig in and more. And if we need to dig in some more, we can certainly do some of that. I think an interesting discussion might be, what are the relative rates at various places and people who are self-paying, and I just know the rates vary considerably between even types of providers, in some cases more than 2 times as much as others. So we all have to spend some time on that. So I really appreciate that. And just one thing else to the department, Ms. Brown, as these applications start rolling in, and I think a lot of them have come in, I'm very interested on the uptake. I would be surprised if many centers don't want to apply. There may be some, And I'm interested in how many of the homes have applied. I've just heard anecdotally that some are put off by still the complexity. And so I'm interested. So I hope that a large number of all will apply. And as you even inquire about to the centers and homes that have chosen not to apply, why did they not want to apply? And so is there some way to simplify that, which was what we were thinking it was going to be, just kind of a simple in and out thing. So anyway, with that, we're going to move on, if that's okay. So Ms. Rydrick, you're back. The elderly waiver thing, is that you? I thought that was Mr. Pollack, but
Mr. Chair, I think that might be a typo on the agenda.
Oh yeah, okay. Yeah, we just want, the more Pollack we can get.
I might even defer to my good colleague Elise Bailey on that one, because I know she was corresponding with you.
Oh yeah, and so so I think at this point I'm just going to ask a question, and so there's an email from Miss Bailey where she said everything she could know, which was they're still waiting to have some, still not quite sure who all is in that group. And so for the people that are not new to this topic, we're able to pass a disproportionate share thing for elderly waiver places that have more than 80%. And for those people in that category, they are just truly serving individuals. And I wish more assisted livings would choose to accept more of that population. Some accept very few. And you're on my list. They get coal if we do that. Is that anyway, if in their stocking, as far as I'm concerned, because we have such a need for the individuals to be served. And when everything's at market rate except for a handful, it just doesn't seem right to me. And so in many ways we tried to do that. We got some additional innovation grants. There are $1 million a year now, and there's a FTE working to make those even more interesting. And so that's going to be underway. Maybe the application is a little shorter than 37 pages. I don't know. That's probably, maybe they can shorten it up in some of their free time, Mr. Pollack, to get it down to 20 or something. But anyway, so then we got this disproportionate share thing. And then it turns out that there are companies that are serving elderly waiver clients, that they have 60% of maybe Caddy or TBI or something, and then another number adding up, that they don't have 80% of elderly waiver, but they maybe have 90% of waiver people in their places. And the proposal was to create the threshold to be 90% of all waivers, and then they would get just the additional share for the elderly waiver component. That would require a law change, and I was frankly reticent about that personally, just because I didn't know who would be harmed by that. And for those who know somebody who's in the 85% level of elderly waiver, please let me know. But I'm kind of leaning toward maybe we need to tweak the law to at least allow this mass amount of people who are in places that are 90%, which is even a higher threshold, to be served. And so Mr. Pollack and Ms. Bailey, I'm just kind of evolving in that, and I don't know the answer. It's certainly a committee decision where the Senate would want to be on that, but I'm looking for input from members or Mr. Pollack or Ms. Bailey if you want to comment about that.
Well, just on the application length, we actually have assigned reading at DHS now. Oh, this is hard to see.
Oh yeah,
a book called Subtract. So we're thinking about how to do things a little easier for people.
That's amazing. Yeah, actually I read that book, and the commissioner gave it to a bunch of people, including myself and some other chairs. It's sometimes less is more, and so that was a really very positive discussion. And so for members who didn't have a chance to do summer reading, I'll lend you my copy for some autumn reading. It's anyway. Thank you. Any members want to comment about this? I don't see any hands. But please, if you're in that bubble of 80.1 or whatever, of 80 to 89.9, please let me know. And Miss Bailey, when you can figure that out, I'd like to know that too. So I won't necessarily call on you, but is that okay? Okay. Thank you for that. Sometimes doing a good thing causes other things that aren't good things, and we've learned enough about that. And so finally, the last big item, Ms. Baston, are you here? We're going to talk about perhaps the last discussion of mandatory testing. Yeah, there you are. And so, and I guess I'm going to just, did you have something you wanted to say, or did you want to just take questions?
Senator Abler, members of the committee, my name is Kristen Batson. I'm the Deputy Commissioner of Enterprise Employee Resources at Minnesota Management and Budget. I did not have any prepared comments today, but okay. I am here to take any questions you might have. Okay, well, I'll start, and then others can go. And I want to, first I want to thank you, believe that or not, for listening as well as you can and making changes to make this program better. I think it's evolved to the point that nobody is getting leave, unpaid leave without a Loudermill. That was not true in the beginning, and that was not your intent. And I think that there was one place who was, and I believe the word was consideration, at least one HR person, I don't even know what agency, was having some trainings on consideration and being considerate of people who may differ with you in a belief, like it is in vaccinations. And so if you want vaccinations and your coworker doesn't, please be considerate of their personally deeply held beliefs. And I thought that's a very positive thing. I heard about a Loudermill hearing that became not a Loudermill hearing when the person had questions and they were going to work on that and come back in a week and finish up, compared to just moving to the more abrupt termination of pay, et cetera. And I think those are evolving, and that has been the very real desire I've had here. And I appreciate Commissioner Showalter, and just, I don't think it's a secret. So he was saying, do we have to come back every week? And no. So I'm pretty confident that if we talk again about other things, it won't include you, so you can plan your time otherwise. But nonetheless, I think it's really important. And I'm not going to micro all these things you sent. I still believe that the amount of people on unpaid leave is far more than what you think. And I don't know how you at the top there could ever know what's going on in the hinterlands. And I having talked to several commissioners, I know what they intend. And I think as the proper treatment, proper training of your HR officials goes forward, they will be much less harsh. But I have to tell you, they've been very harsh with some of these folks. And I've got a few comments I'll read to you from people that have written me. But I see it moving in a very positive direction. And I have two main things I wanted to bring up to you, just to have you put in the back of your head. And I talked to the commissioner about this, and we just don't agree on what discipline is. For my understanding of a state employee, many of whom make mid $20 an hour, losing 3 to 5 days of paid time is amongst the harshest discipline they could experience. They now have to decide that they're not going to get their kids some new shoes or pay the rent, and it's very burdensome on them. Very, very burdensome. And so you'll do what you're going to do, but I hope you consider that to be definitely a slap on the hand and actually a slap in the pocketbook compared to the ordinary way where there's a warning. Before you get to a one-day suspension, you've gone through several steps compared to just, here's the Loudermill and now you're done. So I hope as you evolve in your work that you consider restoring those unpaid days to people. I still urge you about that. And you don't have to comment, I'm just telling you, and I'm not here to embarrass you or be on any way undue to you, but I'm just expressing my opinions. And then the thing that's come up lately, which was mentioned in the last hearing, is the administrative leave days. So if a vaccinated person gets COVID, they get 7 days of paid sick time if they run out of their sick time. If you have not been vaccinated, you don't get any sick time given to you. And I think that is just eminently unfair. And if you're wondering what chord this is striking in me, it's a matter of fairness. And routinely, state employees are treated the same. If you've been here for 4 years, you get so many hours of vacation, you get so much sick day, especially in the same niche of a bargaining unit or as a job title. And this is the first time this has ever happened. And I just going to continue to urge you, and I don't know if the governor has to decide this, but I know the governor has been a big fan of state employees. I know he believes in fairness
and in getting people to be on the same team. But I can tell you that the morale in some of these units has never been lower about this. They wouldn't write you, but they've been writing me. And so that's what's driving me on this. And it's nothing to do, and just so people understand, there's no vaccination mandate. There's a testing mandate, which an employer can do. And then if you happen to have been vaccinated, then they're exempted in Minnesota. And that's created all kinds of questions. And so how you implement that in the form you have to sign, which has gotten better. You took out the waiver of liability if they poke the swab into your brain, which I think a smart person may wonder, I want that back in, please. And some people wound up on unpaid leave for having that concern back in the beginning. So I'm glad you've resolved that. So with that, I'll turn it over to members, and I just have a couple of comments I'm going to read from people after that. So does anybody want to say anything? Making sure I'm seeing hands here. Okay, well, very good. So let me just, since somehow I become a clearinghouse, and so to the people, state employees, one of them said, well, I said, why don't you write? I talked to a commissioner, and they said, well, no one writes me. And by the way, people don't write commissioners routinely. It violates the chain of command, and there's HR and all that. But based upon that one commissioner's view, I think if you have a concern about how it's going, tell them I sent you, and drop your commissioner an email and tell them Senator Abler said I should let you know. And you'll of course be very polite and respectful of their position. But if they don't know how it's being implemented, they cannot possibly know. I'm going to urge you also to write your legislator, because a lot of you aren't doing that. There's 201 of us around the state. You all have at least two. If you live and work elsewhere, you have more. And so just let them know. And I think that as we keep working, the things will get better. But I just want you to know, since nobody else is on the horn here, I just got these emails, and the way it's gone, this one person says, I feel discriminated against, bullied, and I feel like I'm a terrible nurse. I don't think anybody meant that to me. One talked about a hostile work environment. Even more ridiculous is how some talk to you knowing you aren't vaccinated. I'm glad that some people are working on consideration training. And for nothing else, we are a melting pot of all kinds of views. One person walked into an unsecured conference room where all the swabs were with a list of names. And this room was open to the offenders. And she felt they could have been tampered with. And she's pretty graphic in how that might have been tampered with. And so they got all new ones. This is not what you intended. I don't think MMB even knows about that. So this is just from today. We talked about 90 days allowance. If they've had a positive test, they have a 90-day free time. And so this person was in their Loudermill, and she stated that her positive test takes me out of the testing for 90 days, and HR said they don't have proof. I told them I was picking it up after work and could get it to them tonight yet after hours. They emailed me 10 minutes before the end of the workday and already decided on unpaid leave. And then that's not what you meant. And so all my superiors are given access to my health records. That's not what you meant. I've always been proud to be a state employee. I feel bullied. I just want to go back and do my job. That's from one person. This person works from 10 till 6 in the morning. When am I supposed to get tested in my normal duty hours? I do feel I've been harassed. I don't believe your employer should know your vaccination status. I don't trust my employer to not come at me with conduct unbecoming. Where have we gone? And there's some other, those are the soft ones. There's some that were just too harsh. I didn't want to write those, so that's what's provoking me in this. And so please continue your work. I believe, Ms. Bastion, you and the MMB are pushing down an atmosphere of respect, consideration, and improvement in this process, fair treatment of employees, understanding their concerns, and working with them. You still have some work ahead, but I'm not even sure if it's from your end pushing down, but at the implementation level, I think all the commissioners need to be aware. The ones who have a lot of people working at home, there's nothing going on there. But the people that are on the front lines, corrections, human services, MnDOT, and probably some others, they can't stay home. And they're right there. So I won't even make you reply, but I want to thank you for your durability and being here and listening. And I do deeply thank the commissioners, particularly Mr. Showalter, for his listening to my concerns and truly making this better. So we need all our employees. They're just so wonderful people. They want to work for us, and they just want to quietly do their job and be treated well. So anyway, thank you, Ms. Baskin. So you can say goodbye, and then you goodbye.
Thanks very much.
Yeah, thanks a lot. And the final thing is something we're not going to be taking up today, which is a discussion about the Ombudspersons. There has been they're in a transition state, and it's been kind of iffy on how smoothly it's gone. We're gonna have some meetings offline, I think, sort out all of that. And so I spoke to a number of them in the last couple of days. There's still some issues that are close to home, and those are way best decided offline. And so if you want to engage in that discussion, you can let me know, and I'll be happy to talk to you. I think we're close to getting it resolved. The 4 ombudspersons, as you recall, we split off the tribal one and then left the other 3 together of Asian, Hispanic, and the African American ones. They're officing together, and they really provide a benefit. And so as we can get rid of, the challenges of the past, we can get them back on track, helping all the people that really need their help. So I want to thank everybody for your attention today. If anybody wants the last word, I'm happy for that. And so not seeing any people jumping at that. So I think we can, and I didn't mean to have any hearings, I just have to tell you that. But so all these things come up, and I think it's our duty to cover them. Hopefully we've been fair in doing that. So we'll be meeting, I think, in a couple of weeks to talk about the workforce and then the other things we said we might follow up on. And if you as a member of the committee want us to address some topic, I see this as a joint effort, not just mine. So please don't be shy to bring that up. So anyway, thanks everybody. Enjoy the lovely autumn day, and we're adjourned. Thank you.